Welcome to the Paul Chandler Show, everyone. I'm your host, Paul Chandler. In tonight's episode, we're going to be looking at evaluation and management, but only for the office and other outpatient services, only for that aspect of it. Because tomorrow, on January 1st, 2021, begins the new requirements for leveling the E&M codes. So unfortunately, today is the last day for dates of services for 99201. We had a good run, but adios, 99201. So tomorrow we're starting the new requirements. So that we'll be covering that tonight. We're comparing a little bit of how it is for 2020 right now and 2021, but then we'll be going in details also. Now there is a one-page audit tool that we created. If you like, you can pause this episode and download it because we'll be going over that tonight in the show. You can visit thepaulchandlershow.com/episode 98, and then that will appear the one-page PDF you can download if you like and print it out and follow along as we cover tonight the new requirements starting dates of services for tomorrow for evaluation and management for the office and other outpatient services. And welcome back, everyone. And now we're going to be discussing the evaluation and management, also known as E&M, changes only applicable to the office and other outpatient services for the place of service locations that are effective for 2021. Now, so if you remember E&M, that we have the 1995 guidelines and the 1997 guidelines, the only changes that are happening are for the office and other outpatient services for the locations. All the other place of services remain the same. So if you think about it, we have not had changes since 1997, and that was my junior. That was my junior year of high school, and I'm 40 now. So yeah, it's been a while. So now looking at the changes, we still have time as a factor. We can still use E&M with time for the office and other outpatient. Now with these code changes though, 99201, may it rest in peace for dates of services. That is going the in-sync route and going bye, 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 bye. So that is now gone. Here are the times that we can use for dates of services effective January 1st, because remembering that this is effective by date of service for January 1st, 2021. When we're working older claims, as in retro claims back for 2020, then they'll still be done under the old way. So with 99202 through 99205, each of them have the time ranges that you see here. And 99212 through 99215 has those time ranges there. Now, with the E&M levels, like I said, 99201, that code did go away. However, though, we still have 99211. That code has not changed. However, that has never been time-based, nor is it going to be time-based now. Now, for the new patient, for services, as in E&M office visits, or other outpatient visits that are longer than 75 minutes, then we can use the appropriate E&M codes for prolonged services. And for established patients, office and other outpatient visits that are longer than 55 minutes, we can use those prolonged service codes. So the thing is though, when we're making this change on January 1st, it's not a complete revamp, if you will. Think of it more as like an upgrade. That's how I like to look at it. Because the doctor will still need to document the history and exam, because a doctor or a nurse, whoever's seen the patient, still needs to perform a history and perform an exam. On the coder side, though, we don't care about that anymore. So yay to that. There's less documentation that we need to look at. We're only going to be reflecting it off of the MDM for the medical decision making. And it's still the same rule where 2 out of 3 requirements. Now, per the CPT guidelines and the CMS guidelines, you can use any 2 out of the 3 between the number of diagnosis management options, which we know it as of today, the amount and or complexity of data as we know it of today, and the overall risk as we know it of it today. However, though, you should check with insurance carriers, because I do know some insurance carriers will have the policy that with the 2 out of the 3, how you can remove the lowest one, that you have to keep the what we now call in 2020 the overall risk. But now the three different columns, though, are having a little bit tweak as far as the name change. But you should check with the carriers, though, because some carriers may require you to keep the overall risk column, the last column that we're used to, and you can only remove one of the first two. However, though, per CPT guidelines by the AMA and CMS guidelines, you can remove any one out of the three. So there's still only the 2 out of 3 requirements. Now, just a quick review, though, of how we're familiar with them in 2020 and before. So with the 3 different columns that we have for MDM, we're used to the first column being the number of diagnosis and management options, where we score it as a minor problem. And I consider that, think of that as a boo-boo. The patient comes in for a boo-boo, and the doctor's not expect to see the patient again for that boo-boo, if you will. And hopefully, though, the doctor and or nurse are not actually putting in the word boo-boo in the documentation, but minor problem, 1 point each, maximum of 2. So patient comes in with 3 boo-boos, you still just get 2 points. EST and new does not mean established patient and new patient. It means established condition and new condition. If it's an established condition, as in the doctor has seen the patient for this condition before, such as they're here for a follow-up, then if the condition is stable or improved since the last visit, it's 1 point. If the condition is worsening since the last visit, 2 points. And then if it's a new condition, if no workup is planned, 3 points, but we only count it once. So to come in with 2 conditions that are new to the doctor without workup, you don't get 6 points, just 3. And a new condition with workup is 4 points. And really, you can think of it just as a max 1 because we stopped counting at 4. 4 more points, it doesn't matter. And then second column we're used to, the amount and or complexity of data. Here, and this is one of the changes that we are having, just besides a minor little title change in the columns, that we're used to every instance can only be counted once. For example, labs ordered and or reviewed, 1 point. So the doctor orders a panel and a drug test. Those are 2 labs, but still just 1 point. Anything ordered in the CPT section for the medicine section in the CPT book, 1 point. Anything ordered in radiology, 1 point. So again, with a 1 point, a 1 instance maximum, provider orders a CT and an MRI under 2020 rules and before, that's just 1 point, even though it's 2 different tests. If the doctor discusses the results with another doctor, that's not a separable billable E&M code, but they do get 1 point for that. If the doctor decides to obtain additional history, that's HX history, that's 1 point. Then if they take that additional history, example like additional records, and summarize it into their current data service, they get 2 more points for that time. And then if the doctor interprets a specimen or an image on their own to either confirm a diagnosis or to not confirm possibly a diagnosis, then that's 2 points. And just remembering with that, that is not somebody just saying, oh, the radiology came back and yep, it's a hairline fracture of the right femur, for example, just picking one out. That's not interpreting it, that's just copying the results over. So that's what we're used to now with the amount and or complexity of data, with all those columns being 1 point max. And then the overall risk. Now, in our audit tool, we do use a one-page audit tool, and we did acronym it down, but we're used to the presenting problems, diagnostic procedures, management options selected, and all of those different types, the severity levels between straightforward, SF, that does not mean San Francisco, unfortunately. Side note, that's an awesome city to visit, but straightforward, low, moderate, and high. And we're used to that between the presenting problems, diagnostic procedures, and management options selected, that out of all the combination of the 3 rows, whichever one can go farther down, that's the one you take. So now that's what we're used to. Now we do have, if you've not gone to already, you can pause this video if you'd like and go to the paulchandlershow.com/episode 98. And there you will have a one-page audit tool that is for the new office and other outpatient services that goes over the leveling of MDM. Because with the different columns, though, they did have, it's not just we're only going by MDM, but they did tweak it a little bit. And remembering, like I just said at the beginning, though, this only applies to office and other outpatient services. All other place of services, hospital, inpatient, skilled nursing facility, wherever the patient may be, still goes under the good old 95 and 97 guidelines. So before we go into different levels, noticing though with the columns, so we still have the 3 columns. However, though, what we're familiar with is the first column being phrased, the title of it being the number of diagnosis and management options. And you can see at the top item here in purple that the phrase number of diagnosis management options is now going to be called, for office and other outpatient services, number and complexity of problems addressed. So it's kind of the same thing, but they just changed the name a little bit. But what's awesome though is we're not scoring points anymore. So if you like to do a little happy dance on that, then you can pause this if you'd like and do a little happy dance and come right back. We're not scoring points anymore, so yay. Again, so the first column used to be number, diagnosis, and management options. Now it is called number and complexity of problems addressed. The second column, which we're used to being called amount and/or complexity of data, is now called amount and/or complexity of data to be reviewed and analyzed. So they just added, more to that. And then what we're used to being called the overall risk column is now called risk of complications and/or morbidity or mortality of patient management. So now with the overall audit tool itself, now how we did it here though is explaining the different levels. So we only have the 4 levels now, not the 5 anymore. So we have straightforward, low, moderate, and high. And on the one-page audit tool, this is all put together. So looking at the straightforward, that used to just be 1 point. When we're going back with the minor problems are 1 point each, established, stable, improving is 1 point, established worsening is 2 points, new problem without workup is 3 points, and new problem with workup is 4 points. How it's not a point-based system anymore, that to have a straightforward first column, the number and complexity of problems addressed, we just need 1 self-limited or minor problem. For the amount and/or complexity of data to be reviewed and analyzed, that's like all the different tests that are ordered and say all the extra stuff the doctor can do. Doesn't have to do anything. And then what we're used to being the overall risk, now the risk of complications and/or morbidity or mortality of patient management. And I know that's a really long new phrase for it. We have a minimal risk of morbidity from additional diagnostic testing or treatment. Now, that simple phrase, minimal risk of morbidity from additional diagnostic testing or treatment, then we used to have 1 limited or minor problem. Lab tests, chest x-rays, EKG, EEG, urinalysis, ultrasound, echo, KOH prep, rest, gargles, elastic bandages, superficial dressings. So on the old audit tool, we did have more examples on it, but you can still see it's very just a simplistic minor additional diagnostic testing. On the low, we are upping our game a little bit. But now what's different though here is if we're comparing the old way for the first column, that used to be number of diagnosis or management options that had 2 points to it. Now on the first column being named number and complexity of problems addressed, how we only need 2 or more self-limited minor problems, 1 stable chronic illness, or 1 acute uncomplicated illness or injury. So that's the major difference here, where we're not adding points anymore in the first column. We're just giving examples. So a patient can have 1 stable chronic illness, and that used to be 1 point, which would be a straightforward. But now a established stable condition is considered a low. 2 or more self-limited or minor problems, that used to be 2 points, which would be a low also. So that's a difference there, Let's say if a patient has, say, a routine follow-up for one stable chronic illness, that used to be considered a straightforward for the first column, but now it is increased to a low. Or the patient can have one acute, uncomplicated illness or injury. Now in the second column, where you said the amount and or complexity of data by adding up all those points, how they're doing it with the new format is we'll have different categories. And with this, the provider can either have category 1 or category 2 to be able to meet the low requirements. For category 1, and one thing though that is different here, notice though how under this big purple header that says elements of MDM, amount and or complexity of data to be reviewed and analyzed, notice under there though, the little asterisk. Each unique test, order, or document contributes to the combination of 2 or combination of 3 in category 1 below, which means we get credit for every single item that we do now. So yay! So it's not, for example, if the doctor orders 2 labs, that used just to be 1 point. Now they get the actual amount of points for the work that they do. So we can see here in category 1, they can either have review of prior external notes from each unique source, or they can review the results of each unique test, or ordering of each unique test. If they do any 2 out of the 3, that can be a low second column, or they have the assessment requiring an independent historian. And then the last column for what used to be overall risk, but now is the risk of complications and or morbidity of mortality of patient management. And now we have low risk of morbidity for additional diagnostic testing or treatments. So the thing is that with the new audit tool, straightforward and low. We don't have a lot of examples in there for that risk of complications, which is the new third column. However, though, on the moderates, we do. So I did have to move these slides around a little bit, and they may be a little bit smaller on your screen. But again, just a reference, though, that you can go to the paulchandlershow.com/episode 98 and be able to download this full one-page audit tool here. So with the moderates, it's increased a little bit more. So we have the 1 or more chronic illness with exacerbation, progression or side effects of treatment, 2 or more stable chronic illnesses, or 1 undiagnosed new problem with uncertain prognosis, or 1 acute illness with systematic symptoms, or 1 acute complicated injury. So you see, we have a lot of different options here, and we're not scoring up points anymore. And for example, and I'll just choose the stable chronic illness, 2 or more stable chronic illnesses. Under the old format, 2 stable chronic illnesses were 1 point each, so you get 2 points. That would be a low under the old way. 2 or more stable chronic illnesses, 2 still counts, and that's a moderate. So we do see some increasing levels on the first column. And then dealing with the second column, which is on the bottom half, now we have 3 different categories. Still with category 1 with the test documents and independent historians, doing any 3 out of those 4 options. Or if the doctor does an independent interpretation of tests, that automatically counts as a moderate. And that used to be 2 points, which would be a low, but now that's in a category 2 for a moderate. So that's an increase of severity level as well now. Or they can do the category 3, discuss of management or test interpretation. So we have different items here, 3 options for the second column. Now then on the top right of the slide, we have the risk of complications. And again, I had to put it kind of out of order there to get it all on one slide here. And here we do have some examples. So it's moderate risk, but some examples of prescription drug management, which was a moderate before and is still a moderate. Minor surgery with risk factors is still moderate. And elective surgery without risk factors, that is still a moderate. And then the 99220 for the 99215. We have for the first column, one or more chronic illnesses of severe exacerbation, progression, or side effects of treatment, or one acute or chronic illness of injury that poses a threat to the life of or bodily function. And so here it's a little bit different because, for example, the one or more chronic illnesses with severe exacerbation. So that could be an established condition that's worsening. That used to be 2 points. And now it says one or more chronic illnesses with severe exacerbation, progression, or side effects of treatment. Used to need to get 4 points to get a high for the first column, but that one worsening chronic condition, which was 2 points, a low, now right there, that can classify you as a high for the first column. Or the one acute or chronic illness or injury that poses a threat to life of bodily function. That's a new concept here too, because under the old way, we had no clarifications on was it a threat to life. It was just, is it worsening or stable since the last condition? And then with the second column, for the amount and or complexity of data to be reviewed and analyzed, we still have 3 separate categories as well. They can choose a category 1, where a combination of any of those 4 items. Review prior external notes for each unique source, review the results of each unique test, ordering of each unique test, or assessing requiring an independent store. They can do any 3 of those 4, or they can again do their own independent interpretation of tests, or they can discuss management of test interpretations. And then with the last column that used to be called overall risk, but now is risk of complications and or morbidity, high risk morbidity from additional diagnostic testing treatments. And we have some examples here. Drug therapy requiring intensive monitoring for toxicity, decision regarding elective major surgery with risk factors, patients having emergency major surgery, patient is going to be hospitalized, or the decision to not resuscitate or de-escalate care because of poor prognosis. Meaning, for example, if the patient decides to sign a DNR, do not resuscitate. So like you can see here that as we also went to slides, straightforward is a level 2 across the board, 99202, 99212. Low is level 3 across the board, 99203 or 99213. Moderate is level 4 across the board, 99204, 99214. And a high is a level 5 across the board, 99205, 99215. Welcome back, everyone, and thank you for taking the time out to watch that education on the new E&M, or Evaluation and Management, requirements for when we do the coding for the leveling of office and other outpatient. Now, just remember to go to thepaulchandlershow.com/episode 98, where you can download that PDF of the one-page audit tool if you've not done so already, and feel free to use that in your office as well. So for now, thank you for watching The Paul Chandler Show, and have an awesome rest of your night.